Hi, my name is Jenna. I'm a student nurse. I'm going to be doing your assessment today. I just have to wash my hands and set up my equipment.
Yeah.
Wash my hands. I have an alcohol swab, cleaning my stethoscope with it. I have gloves. I have soap. I have my pen light, and I've got my stethoscope. Okay, can you tell me your name?
Danielle.
Why you're here?
Appointment.
What time is it?
7:30.
And where are you?
Portland.
Okay, do you wear any assistive devices?
No.
Are you in any pain?
No.
Patient reports not being in any pain. Patient uses no assistive devices. Patient's alert and oriented ×3. Her level of consciousness is alert and conscious. Her speech is clear and articulate. Patient is pleasant and cooperative. Patient is able to respond to my questions. She's dressed appropriately for the weather and exhibits adequate hygiene skills. Okay, I'm going to start off the assessment by touching you in 3 different areas. If you can identify those places for me with your eyes closed.
My left cheek, right arm, left leg.
Okay, patient can accurately identify all 3 points that I touched her in, indicating that her sensation is intact in the upper and the lower extremities, as well as the face. Okay, can you puff out your cheeks for me? Smile, frown, raise your eyebrows. Okay, patient's facial nerves are intact, specifically cranial nerve 7. Can you take your finger and touch your nose? Then touch your finger to mine, 3 different spots. Okay, patient's able to follow commands and her coordination is intact. Can you take your fingers and touch them to your thumbs? Okay. Patient's fine motor skills are intact. Can you stand up, please? Patient, can you walk to the wall? And walk back to me. Okay, patient's gross motor skills are intact. Patient's posture is erect and midline. Her head is centered on the body, proportionate to the rest of the body. It's erect. Her shoulders and her hips are aligned. Do you experience any pain while walking?
No.
Patient reports no pain while walking. Okay. Her posture is erect. The gait exhibits no signs of limps or swaying. Can you bend down and touch your toes for me? I'm going to palpate your spine. Okay. Do you feel any pain with that?
No.
Patient reports no pain upon palpation of the spine. The spine is centered, no signs of curvature, no signs of lesions, wounds, masses, or lumps in the back. Okay, can you hold your arms out straight for me and close your eyes? Okay, patient exhibits no signs of swaying upon performance of the Romberg test. She can maintain her balance while her eyes are closed. Can you stand on one foot and the other foot? Patient exhibits no swaying upon standing on one foot, indicating that her balance is intact as well. You can take a seat. Can you take your heel and rub it up and down your shins for me? Okay, patient's gross motor skills are intact as well. I'm going to tell you 3 words I'd like you to remember for the rest of the assessment. If you can tell them to me later on, that would be great. They're dog, cat, and mouse.
Okay.
Okay, I'm grabbing some gloves just for infection control before I palpate the patient's scalp. Okay, upon inspection of the facial features are symmetrical on the face. The skin around the eyes, nose, and mouth are pink and appear dry with no excess moisture. The ears appear pink with no excess moisture and are dry. I'm going to palpate your face. Do you feel any pain?
No.
Patient reports no pain upon palpation of the face. Skin is warm and dry with no excess moisture, no signs of lesions, adhesions, or wounds. The skin color is evenly distributed to the rest of the body. No signs of tics or tremors as well. The head is centered and erect on the head and midline. I'm going to palpate your scalp. Do you feel any pain?
No.
Patient reports no pain upon palpation of the scalp. Hair is evenly distributed, no signs of infestations. The scalp skin is pink, warm, and dry with no excess moisture. No signs of lesions, adhesions, wounds. Skull is round with no deformities. The hair shows no signs of breakage. It's smooth and shiny in texture. No signs of infestations. No signs of edema or swelling as well. Okay? I'm going to perform a whisper test. I'm going to whisper a word in each ear. If you can please repeat back what they are.
Water. Tree.
Patient's able to correctly identify the 2 words I whispered into her ears, indicating that she has no hearing impairments. Okay, so upon inspection of the ears appear to have no swelling or edema or lesions or wounds. Do you experience any ear pain ever?
No.
Patient reports no ear pain. Ears are symmetrical on the head and midline. They appear fully developed. There's no evidence of drainage at all. Do you mind if I palpate?
No.
Upon palpation, no signs of swelling or edema. Do you feel any pain upon palpation?
No.
Patient reports no pain upon palpation. Skin is warm to the touch and dry with no excess moisture. Okay, so moving on to the eyes. The irises and the pupils are round. The pupils are 6 millimeters in diameter, symmetrically and bilaterally. The sclera is white, smooth, and clear. Bilaterally, no signs of discoloration or redness. Scleras are clear. The conjunctiva are clear bilaterally and symmetrically. Eyes are almond-shaped and symmetrical on the face and proportionate to the body. The eyelids show no signs of drooping or edema or swelling. The eyelashes and the eyebrows show even hair distribution, are evenly distributed, no signs of hair loss. The corneas are transparent bilaterally, no signs of drainage. Do you experience any eye pain?
No.
Patient reports no eye pain, ear pain?
No.
Patient reports no ear pain. Okay. So I'm going to test your reactivity to light. Okay. The pupils constrict concentrically and are reacted to light bilaterally. Can you follow my pen with your eyes? I'm performing the 6 cardinal fields of gaze test. Okay. Patient's eyes move symmetrically and smoothly in all cardinal fields of gaze. Patient's also able to accommodate. There's no signs of nystagmus, so patient is perla. Pupils are round, equal, and reactive to light and accommodate. The patient exhibits no swaying of the eyes as well. I'm going to perform the peripheral vision test. Tell me when you see my fingers.
There.
Patient's peripheral vision is intact. Okay. Moving down to the nose. The nose is midline, proportionate to the size of the face, even in color. Do you experience any nose pain or drainage?
No.
Patient reports no nose pain or drainage. Can you close one nostril for me? Breathe in, and the other one. Patient's nares are patent bilaterally. Okay. There's no evidence of occlusions or deviated septums. I'm going to grab an object. I'd like you to identify the smell for me with your eyes closed. So, yeah. Patient's able to correctly identify the object by smelling it and indicating that there's no impairments of the smelling sensation. Okay. We're moving down to your mouth. The patient's lips are moist and pink with no evidence of cracking or skin deterioration or lesions in the correct position on the face. Do you mind if you open your mouth? Say ah. Okay. Patient's uvula is midline and moves upward upon saying ah. The tonsils show no signs of inflammation or infection. The oral cavity is pink and moist. The mucosa is pink and moist. Tongue is symmetrical and midline, pink and moist. Patient exhibits good dentition. No foul odors are coming from the mouth. The gums do not show any signs of bleeding. Do you experience any mouth pain?
No.
Patient reports no mouth pain. Okay. Okay. So I'm going to move on to palpating your sinuses. The frontal and the maxillary, do you feel any pain?
No.
Patient reports no pain upon palpation of the sinuses. No swelling, tenderness, or inflammation or hardening of the sinuses is present. The skin is warm and dry, no excess moisture. I'm palpating the preauricular and postauricular, submandibular, and cervical lymph nodes. Do you feel any pain with that?
No.
Patient reports no pain upon palpation of the lymph nodes, indicating no signs of infections, no hardening or tenderness or swelling of the lymph nodes as well. They're non-palpable. Okay, do you remember the 3 words I told you?
Dog, cat, and mouse.
Okay, patient's short-term memory is intact. She's able to recall the 3 words I told her earlier. Okay, upon inspection of the patient's neck, the skin is evenly distributed to the rest of the body. No lesions, wounds, edema, swelling, no rashes. The neck muscles are symmetrical, no jugular vein distension. I'm going to palpate. Can you swallow for me? Okay, do you feel any pain with that?
No.
Patient reports no pain upon swallowing or palpation of the neck. The trachea is midline. The thyroid gland is non-palpable. Okay. I'm going to palpate the carotid arteries. Carotid arteries are equal in strength bilaterally 2+. Rate and rhythm are regular. Auscultating. Okay, upon auscultation, no bruits or bushings are present. Okay, so I'm going to perform some range of motion in the neck. Can you put your chin to your chest? All the way back. Ear to shoulder, ear to shoulder. Push against my hand, push against my hand. Okay. Patient's strength is symmetrical and bilaterally 5 out of 5. And Patient can perform full range of motion of the neck. Do you experience any pain in the shoulder joint?
No.
And the neck joint?
No.
Okay, patient exhibits no signs of pain, reports no pain upon movement of the neck. Strength is 5 out of 5 and full range of motion is present. Okay? I'm looking at your precordium in the chest cavity. No signs of rashes or discoloration of the chest. Skin is pink and dry with no excess moisture. The skin is evenly distributed to the rest of the body. I'm just going to palpate. Lymph nodes are non-palpable. Do you feel any pain with that?
Nope.
Any chest pain?
Nope.
Patient reports no chest pain. There's no signs of crepitus, leaves, hips, lips, or thrills. Okay. I'm just going to auscultate the heart sounds, starting in the second right intercostal space, the apical. Second left intercostal space, the pulmonic. Third, Erb's point. Fourth, the tricuspid. And fifth, the mitral. Flipping over to my bell, listening to the mitral again, and the tricuspid. Okay, upon auscultation of the heart, S1 and S2 sounds are present. Rate and rhythm is regular. No evidence of murmurs. Okay, upon inspection of the patient, she's not using any accessory muscles for breathing. Do you have any difficulty breathing or pain?
No.
Patient reports no pain or difficulty breathing. Patient's chest cavity is cone-shaped. She's breathing with ease and it's quiet. Does not appear to be in any respiratory distress. Okay, I'm just going to listen to the lung sounds anteriorly. Breathe in for me. Okay, lungs are clear on auscultation. No adventitious breath sounds, rales, rhonchi, wheezing, or crackling. Vesicular and bronchopesicular sounds are present. Okay, I'm just going to lift up your shirt. On inspection of the skin of the back, skin is pink and dry, no excess moisture, no lesions, wounds, edema, swelling, no masses or lumps. Do you feel any pain?
No.
Patient reports no pain at the back. Skin is warm and dry and no excess moisture. Okay, I'm just going to listen to your lung sounds in the back. Take a deep breath when you feel my stethoscope. Okay, bronchovesicular sounds are noted midline, and vesicular sounds are noted in the periphery, same as the anterior lung sounds. No adventitious breath sounds are present, no rales, rhonchi, wheezing, or crackling. Lungs are clear in auscultation anteriorly and posteriorly. Okay, can you take a deep breath in for me? I'm checking for lung expansion. Okay, lungs expand symmetrically and bilaterally as evidenced by my thumbs moving 1 inch apart. Okay, I'm going to check for some range of motion and some strength in the upper extremities. You pull up on my hands. You can move your arms in big circles. Do you experience any pain with that?
No.
No pain reported in the shoulder joints. No crepitus noted. No tenderness. Strength is bilateral in the upper shoulders. Full range of motion is performed bilaterally and symmetrically in both shoulder joints. Strength is 5 out of 5. Okay, I'm just going to bend your elbow, twirl your wrist, spread your fingers wide. Bend your elbow, twirl your wrist, spread your fingers wide. Okay, can you pull up on my arms? Push down, squeeze. Okay, patient strength is 5 out of 5 bilaterally and symmetrically in all upper extremities. Patient can perform full range of motion of the joints and the shoulders, elbows, and the wrists and the fingers bilaterally and symmetrically. Do you feel any pain in any of the joints of the arms?
No.
Patient reports no pain in any of the joints of the arms upon movement, so full range of motion is intact. Okay, I'm assessing the fingers for capillary refill. Both are capillary refill less than 3 seconds bilaterally. Skin turgor on the patient's left exhibits a brisk recoil, no evidence of tenting. On the right, brisk recoil, no evidence of tenting, indicating adequate hydration status. Can you hold your fingers up together, your nails? Patient's nails show a diamond shape, an angle of less than 160, indicating no signs of clubbing. And then feel your radial pulses. Radial pulses are equal in strength bilaterally 2+. Skin of the hands and the arms matches the rest of the body, evenly distributed. No signs of lesions, edema, wounds, swelling. or infections. Skin is warm, pink, and dry with no excess moisture. Okay, so strength is, you can lay down for me. Strength in the upper extremities is 5 out of 5, bilaterally and symmetrically in all areas. Okay? Patient can perform full range of motion. Okay? Upon inspection of the abdominal cavity, skin appears dry and pink. Do you feel any pain, nausea, or vomiting?
Nope.
Patient reports no pain, nausea, or vomiting. There's no lesions, wounds, edema, swelling. No masses are present. Skin matches the rest of the body, evenly distributed. I'm just going to listen to the bowel sounds and the vascular sounds in all 4 quadrants of the bowel for 1 full minute. Okay? Upon auscultation of the vowel sounds are present, no hyper or hypoactivity of the vowel sounds. Upon auscultation of the vascular sounds, no bruits or whooshing is heard. Okay, I'm going to palpate. Upon palpation, skin is warm and dry with no excess moisture. There's no hernias, no lumps or masses. Okay, do you feel any pain upon palpation?
No.
Patient reports no pain upon palpation. Okay, can you pull your leg out straight? I'm going to do some range of motion and strength. Pull up, flexion, extension, abduction, adduction, circumduction. Okay, pull up, flexion, extension, abduction, adduction, circumduction. Do you feel any pain in the knee joints or the hips?
No.
Patient reports no pain in the joints of the legs or the hips. Skin matches the rest of the body, evenly distributed, pink, warm, and dry, no excess moisture, no lesions, edema, swelling, or wounds, or infections. Okay? Patient can perform full range of motion of the legs, and the legs are equal in strength bilaterally and symmetrically, 5 out of 5. Okay, can you push against my hand with your foot and pull up, and push up, and push down? Can you twirl your ankle in a circle, spread your toes? Twirl your ankle in a circle, spread your toes. Okay, do you feel any pain in ankle joints?
No.
Patient reports no pain in the ankle joints or the toes. Skin turgor on both feet, brisk recoiling bilaterally, no evidence of tenting. Capillary refill less than 3 seconds bilaterally and symmetrically, no evidence of tenting. No signs of clubbing in the toes, dorsalis pedis, equal in strength bilaterally, 2+. Posterior tibialis, equal in strength bilaterally, 2+. Skin is warm, dry, pink, no excess moisture, no evidence of lesions, wounds, edema, or swelling. They are evenly distributed to the rest of the body, equal in color. Do you experience any pain in the feet?
No.
Patient reports no pain in the feet or movement of range of motion. Feet are equal in strength bilaterally, 5 out of 5, and exhibit full range of motion. Okay?
Okay.
Thank you so much.
Thank you.